Good evening, everyone, and welcome to this very, very special talk on World Hypertension Day. World Hypertension Day is actually on 17th of May, and we're going to be talking about this very, very important topic today. My name is Reena Rupani. I'm your host for today. And anybody here who is first time joining a Sharan talk, please type me in the chat box if you're joining a Sharan talk for the first time. Welcome, Malik. Okay, increase the volume. I hope I'm clear. Welcome, Ankur. Okay, so anybody here who would like to share, welcome, Achal, would like to share why are they here today? Why are you here on a talk on hypertension or heart disease? Why are you here for that? If you could please type in the chat box. Why have you joined today's talk? We We love to make our sessions interactive, so I'd really appreciate if everybody just puts in a little bit of effort. Okay, Malik, I have hypertension. All right, thank you. Anybody else? Why are you here? Why are you taking out this time to come and listen to this talk? I have hypertension too. Okay, after that. Because you care for your health. Beautiful, Bhavna. Thank you. I'm following the Sharan diet. My hypertension is normal. Amazing, Palak. I'm here for my husband who has a family history of heart disease. Great, Dipti. Prevention is always better than cure, isn't it? Wonderful. Anybody else? I lost my father in February post bypass surgery due to atherosclerosis. All right. Thank you, Ankur, for sharing that. Uh, Great, Malik. That's a beautiful step that you have taken. Okay. All right. Thank you, everyone, for sharing, and you can keep sharing. But let's start today's session. I would like to start by introducing SHARAN. SHARAN is an organization which was started by Dr. Nandita Shah. And, I used to always believe that when we are sick, we go to the doctor gives us medicine, we take the medicine, we become fine. But little did I realize that the reason I got sick in the first place is mostly because of certain things that I was doing. And this is the biggest blessing or lesson that we learn when we interact with Sharan, because we learn to understand that our health is in our own hands and that we are the author of our health and we are the author of our disease. And the beauty is that we can actually rewrite the story. So, without much ado, I'd like to invite Dr. Shah. Dr. Shah is treated herself by making all the changes that she's going to be sharing with you. She had an autoimmune disease, very rare one actually, called Guillain-Barré, where she was paralyzed, and she healed herself through a natural way. She was a homeopath, so she believed in natural healing, but she went even a step further. Then she stopped her homeopathy practice and only started changing the way we eat, we think, we do things. And as she started doing that with herself and she saw so many results, she trained under many experts and started doing this for others too. And now, oh, it's been over 20 years that she is the pioneer in this whole food plant-based space in India. And she's also the author of the bestseller Reversing Diabetes in 21 Days. Plus, she's also the recipient of the Nari Shakti Puraskar, which is the highest award for civilians in our country, for women in our country. So, without much ado, please allow me to have Dr. Shah take over. Okay, over
Reena,
to you. Thank you.
Reena, thank you for that introduction. And all of you, I'm so happy to see you all. And is there anyone here who would like to share how, that improvement in heart disease, hypertension, or stroke with Sharan lifestyle? if anyone has already improved and would like to share, just so that the others know that, okay, Akhila, thank you for sharing that. Anyone else? So I just want to tell you that anyone here who has hypertension, or even if you don't have it today, but could get it because of family history or lifestyle, here's the opportunity to get totally free of all these things. And we just have to do it. Obviously, I won't be able to tell you everything here today, but I'll tell you enough so that you can get onto the track and start getting well. Okay, so that's my goal, that you all get well totally. Okay, so let me start sharing my screen right away. Uh, Here we are. Hypertension, heart disease, and stroke can be prevented, and actually, they can even be reversed. That's what I'm here to tell you, that they can be reversed. Obviously, if you've had a stroke and you have the effects of that for a long time, it can't be reversed. But hypertension can be reversed, and hypertension is the cause of heart disease and stroke and many other diseases that we'll see today. So, a few facts about this first. The majority of people with hypertension are not even aware that they have it. So, what can you do for this? Make sure that you get it checked once a year. And if you already have hypertension, hypertension means high blood pressure. If you already have high blood pressure, make sure that you get an instrument that you can check yourself at home. Sometimes my patients go to the doctor and their blood pressure is high. But when they come home and check, and even if they check every single day, it's not high. That's, the white coat anxiety. People's blood pressure just shoots up when they're at the doctor's. But if that's not the case, and if your blood pressure is really high, so you can tell just by having an instrument and making sure what your blood pressure is at home, right? And nowadays, so many people have it. It's a digital instrument and it's not too expensive. If the blood pressure is more than 140 by 90 on 2 consecutive days, it's considered high blood pressure. One day it can be high just because you're stressed, but if it's consistently high, high blood pressure, that means we have to start working on it then. Now, many people, they tell me when I ask them what their blood pressure is, because they have a machine, they're checking it, they'll say 140. No, you need to check 140 and the lower, that means the systolic is 140 and the diastolic 90. And I'll explain to you what these are exactly also soon. And many young people have it. In fact, just yesterday I saw a patient who's only 39 and he has serious high blood pressure. So, we need to start acting as soon as we can and start checking also. And high blood pressure can lead to erectile dysfunction in men, coronary artery disease, that means heart attacks, stroke, chronic kidney disease, which is often the result of high blood pressure. And many people sometimes don't even recognize that they are going into kidney failure or chronic kidney disease because of their high blood pressure. So high blood pressure must always be looked after. And dementia, and I'll soon talk about why all these diseases and more can be the result of high blood pressure. I mean, not only dementia, even things like macular degeneration, eye symptoms, etc. And today, 1.4 billion adults have hypertension, and only 44% of them are being treated. Now, I recently saw a film called The Brown Heart. You can go to YouTube and see it for free too. And it's a film made by doctors Nirmal and Renu Joshi. And they were childhood sweethearts. They got married. Both of them were doctors. And they were hiking enthusiasts. They were interested in health. And one day while hiking, Dr. Renu Joshi got chest pain and had to be rushed to the hospital. I'm going to show you a short trailer of this film so that you know what it's all about. This is just 2 minutes long, and then we'll get into our talk.
In the middle of a beautiful hike at 8,000 feet above the sea level in Uttarakhand, I had chest pain. For a minute, I thought I may not make it. जिंदगी में पहली बार गुजरने का डर लगा.
For many of us from the Indian subcontinent, time may be running out fast. A human enemy, the heart attack.
Heart attack. Heart attack. There's a rise in heart attacks among young people.
This is an epidemic.
Yeah, we're talking about people of South Asian descent.
Our real journey took us to 3 different continents, specifically to India, United Kingdom, and the United States.
70% of deaths from heart attacks occurred in people between ages 30 and 60.
2.5 लाख लोग हर साल स्टील मिशन एमआई से हिंदुस्तान में मर रहे हैं.
So both of us set out to uncover what is behind the staggering loss of life.
उस टाइम इतना पेन हुआ था कि ना तो कुछ बोल पा रहा था मैं.
The common thread is just how frequent heart attacks are. We spoke to some of the best heart experts in the world.
When they talk, people listen.
डायबिटीज, हाई ब्लड प्रेशर, कोलेस्ट्रॉल, मोटापा जैसे हमारे मॉडर्न आभूषण बन गए.
Heart disease and its risk as a whole in women seems to be very, very under-recognized.
Why is it happening?
Is it our genes? You know you shouldn't be smoking.
80% diet, 20% everything else.
Some of the causes of heart attack.
Habits are created by a loop, right? Cue, craving, action, and reward.
So I have lost between 14 to 15 pounds.
Life is beautiful. Let's take care of ourselves better.
तो सवाल ये है कि क्या ये हमारी किस्मत है? और अगर किस्मत है तो क्या हम किस्मत बदल सकते हैं?
Okay, so that's really worth seeing. I hope you could hear it all.
Yes, we could, doctor.
Oh, great. And so let's talk about what is blood pressure. Not high, what is blood pressure? Okay, so here's the heart. The heart is behind the thoracic cage, totally protected. And if you have to do some heart intervention, you actually have to go through this thoracic cage, which we were never meant to do. Right? We were not meant to cut the bone, the sternum, the center bone, and enter inside this thoracic cage. But anyway, sometimes these interventions are life-saving. Now, this heart, the goal of the heart is to pump the blood, oxygenated blood, through the entire body through a series of what you see in red, arteries, and what you see in blue is the veins that bring the blood back to the heart. Now, the amount of pressure that the heart has to exert in order to push the blood everywhere is the systolic, the higher blood pressure. And then between the two heartbeats, between the two pumping, the pressure that is reached, that is the diastolic. Now the diastolic should not be very high. That means it should relax a little bit between the two heartbeats. But over a period of time, our arteries are changing. Like when we are born, the arteries are really nice and clean. But because of our diet, over the years, they are getting narrower and narrower. And as you can imagine, if the arteries are narrow, the heart has to pump harder to push the blood everywhere. That's high blood pressure, right? So what we need to prevent is this blocking of the arteries. And we have to understand why these arteries are getting blocked so that we can reverse them. Now, here you see a nice clean artery, but if, say, we consume a meal with fat, then the fat goes into the bloodstream. The blood is in a fluid like water, but when fat goes in, it's just like putting a tablespoon of fat in a glass of water or in a bottle of water. The water becomes viscid and it doesn't flow very well. And it's the same way when the blood becomes thick, and you know doctors give blood thinners for this. When the blood becomes thick, it injures the artery walls. You can see my arrow, and these injuries are bandaged over a period of time with cholesterol. Cholesterol is a bandage, and each time we eat a fatty meal, we can tear the artery wall, and over a period of time, this bandage gets thicker and thicker, and the artery gets narrower and narrower. Now, that's not a big problem. Our body always works to heal, and I'm just going to go 2 slides ahead here. Our body always works to heal, and if an artery is blocking, there's a collateral circulation, an automatic bypass circulation taking place, so that when the artery is totally blocked, no problem. How beautiful the body is. However, if a piece of plaque, you know, that cholesterol lining the arteries, if a piece of plaque breaks off one day and goes and suddenly blocks the artery, then there's no time for that collateral circulation to take place, and then we can have a problem. If this happens in the heart, then this is a heart attack. But if the artery is getting blocked slowly, you can see here that it's nearly 100% blocked. You can see here that it's nearly 100% blocked. But this 100% block is dangerous. This 100% block is not dangerous, because the collateral circulation has taken place, because this block has occurred over a period of time. Are you with me on this? Now, our duty, no matter what it is, however the artery has got blocked, our duty is to unblock the artery. And so we have to figure out how are we going to unblock the artery. Now, before we get there, we are just going to talk about symptoms of hypertension. And I want to say that, you know, as you see, 44% of the people are being treated, the other people are not being treated. This is because they don't even know they have hypertension, because there are no symptoms. In fact, until our arteries are 70% blocked, we don't have any symptoms of hypertension. That means that we really need to start taking preventive measures right from now, because we don't want to wait till our arteries are 70% blocked and then say, oops, now I have hypertension. So what are the symptoms? There can be chronic headaches that last for days, dizziness and vertigo, blurry or double vision, drowsiness or fatigue, especially fatigue, impotency, erectile dysfunction. In fact, erectile dysfunction and impotency can come way before someone understands that they have hypertension. Shortness of breath, heart palpitations, flushing of the face, nosebleeds, frequent urging to urinate, especially at night, tingling in the ringing in the ears. All of these are symptoms of hypertension. So That doesn't mean that all these symptoms means that you have hypertension, but they could be pointing to hypertension. And nausea also. Now, blocked arteries anywhere can result in disease because the arteries have to bring oxygenated blood, oxygen as well as food to every single cell in the body. So, if an artery is blocked, the tissue that is fed by that artery will die. That results in disease. So, if an artery to the heart is blocked, this means heart attack. If the artery to the brain is blocked suddenly, this is a stroke. But if the arteries to the brain are gradually getting narrower and narrower, then we could be losing function or memory. This could be a cause of dementia, right? So, if we don't get enough blood flow to our joints, we will get joint pain. Just as when we get a heart attack, the body screams out with pain in the chest. When we don't have enough circulation to the joints, then that part screams out in pain. So if we have backache or joint pain or headache or anything, we should check if our arteries are getting blocked. And actually they are, everyone's arteries are getting blocked unless we do eat and live the way nature taught us to eat and live, the way nature expected us to eat and live. Animals do that, but we don't. So the current approaches to this problem by doctors is limit red meat and fried foods, because it's the fat that is thickening the blood, right? And where does fat come from? Oil, ghee, butter, as well as non-veg. Now it's not just red meat. Anyone who's a non-vegetarian knows that if you boil meat, fish, chicken or milk, even vegetarians, if you boil any animal product, you get fat on top. Now, plants also contain fats. Peanuts contain fat, sesame contains fat, almond contains fat, cashews contain fat, coconut contains fat. But if you boil any of these things, you don't get a layer of fat on top. That's because the fiber holds on to the fat. The second thing that doctors say is reduce the salt intake. This is largely true, and that's because today we're eating too much salt. For example, if you are eating any packaged food, salt is addictive. The chances are that they have added more salt than is used in the home. Except for if we're eating a lot of packaged food, then we get used to high salt, then we put more salt in our food at home also. So we should be on a low salt diet. And then doctors give antihypertensives. Doctors give something to make the arteries widen, right? They've got narrow due to the blockage, but the artery is an elastic substance. So you can use medicines to widen the arteries. It's called vasodilation. Vaso means arteries, dilation of the arteries. So there are drugs to cause vasodilation so that you don't feel like you have high blood pressure anymore, because the drug has now made your artery wider. And then doctors use blood thinners, because the problem is that the blood has become viscid, thick, because of the fat. Instead of telling people that lower your salt, don't eat oil, don't eat any fats, eat more fiber, they say take a blood thinner. So patients are on blood thinners, and then doctors give cholesterol lowering drugs. And here I want to say that cholesterol is never the problem. But only animals produce cholesterol. There is no cholesterol in plants. Cashews and coconut also do not contain cholesterol because they're not animals, right? There's no cholesterol in plants. But we are animals. We produce cholesterol and we produce all the cholesterol that we need. The excess is coming from the animal products in our diet. And then interventions, heart interventions. Now, as I explained before, this is not supposed to happen. It's not supposed to, we should not be cutting open the sternum and opening the thoracic cage and meddling with the heart. But today, surgeons have, perfected this art, and nowadays there's even robotic surgery. But the problem with interventions is that even if one spot is blocked 100% or 80% or 90%, even if one spot looks scary, if the same blood is going through all the arteries of the body, today if we solve it in one spot, we are going to get it in another spot if we don't remove the cause of the problem. So when we want to reverse disease, we need to remove the cause of the problem. How will you reverse any disease? Not by removing the symptoms. This is what doctors do with the antihypertensives and the blood thinners and the cholesterol medication, but we would remove the cause of the problem, the root cause, and that's what we're going to discuss today. What are the causes of hypertension and heart disease? Number one cause, I already explained, is fat. Number two cause is lack of fiber, because fiber is what holds on to the fat and ushers it out of the body. The stool that, we pass stool every day, the stool is made up of fiber, plus our microbiome, our the good bacteria in the gut require a lot of fiber in order that they can function properly and do all their functions, like they look after immunity, they look after our emotions, they look after even certain like for example, they have certain things they do help us to produce vitamin D, right? They produce short chain fatty acids by eating fiber. And so if we don't have a diet full of fiber, we have problems. And the only plants have fiber in it. But if we refine those plants, like sugar, oil, white rice, white flour, these are refined plant products. Juice, jaggery, all of these are refined, right? We should not lose any fiber. We should not even peel our vegetables or fruits, or we should keep all the fiber that we possibly can, because that's what's going to be curative for hypertension. Remember, drugs are never curative. Drugs are only temporarily relieving symptoms. They need to be taken every day. But fiber is curative. And then meat and free radicals. Meat contains inflammation, causes inflammation in the arteries because of the free radicals that it has. And in order to antidote those free radicals, we need antioxidants. And antioxidants are present in all plants. So we need to have more plants and less animal products, because animal products don't have fiber and they have free radicals, they don't have antioxidants. They are inflammation causing in our arteries, and that makes the artery narrower. When you have inflammation somewhere, then there's a kind of swelling inside. And then stress. When we are stressed, our body is supposed to produce a fight or flight reaction in response to adrenaline. When we are stressed, we produce adrenaline. But you know something? The animals that we consume or their secretions, they are always stressed. They're kept in a state of continuous stress because of the way they're treated. They are being exploited their entire lives, they're not allowed to live free, and they have a lot of adrenaline, stress hormones, which come back to us when we consume either them or their products. So we have to be really wise to avoid foods with animal products. And then lack of exercise. The more exercise you do, the faster your heart beats, the more oxygenation goes everywhere. So it's really important to keep your body fit with exercise. And then rest is equally important as exercise. So it's good to get a good 8 hours of rest every night, and the best time to sleep is when it's dark. Between 10 and 4, our body works to heal, but you have to be asleep. So it's really advantageous to go to bed before 10 and wake up after 4 so that you don't lose any hours of sleep, of healing, right? That's why early to bed and early to rise makes a man healthy, wealthy, and wise. And then lack of vitamin B12. Vitamin B12, lack of vitamin B12 causes homocysteine to rise, which can be the cause of hypertension and heart disease. So it's really important for everyone, no matter which diet they're on, to check and if necessary supplement vitamin B12. And then tea, coffee, colas, alcohol and smoking literally raise blood pressure, and so they need to be ideally avoided or minimized. And excess salt we already talked about. And genes, in the Brown Heart they have listed genes as the number one cause. But the problem is that, the Brown Heart is a fabulous film, and they have talked a lot about the things that we can do to prevent and reverse heart disease and hypertension. But they haven't said anything about a plant-based diet because, like most doctors, they don't know about it. And unfortunately, they haven't read the books that have been there since 1990. Dean Ornish's Reversing Heart Disease talks about how heart disease can be reversed with a plant-based diet. Imagine. And just to say a few words about why we should be on a plant-based diet. Every animal eats according to instinct. This is especially for those people who are new here. Every animal eats according to instincts. Like a cow will naturally eat grass, a lion will naturally eat meat, but we call ourselves omnivores and we eat everything. But if we were to close our eyes and think about it and go into our instincts, imagine if you're on a farm and you see fruits and vegetables growing, our instinct is to pick and eat them. But if we see a chicken walk by or a goat or a cow, our mouth doesn't water because it's not our food, right? Every baby loves their mother's milk, but when you first give them cow's milk, they don't appreciate. And that's just because they instinctively know that this is not my food. But then mothers add sugar and cocoa and run around them and put that milk down their throat. So instead of listening to doctors and all kinds of other people who tell us that milk is good for health and that we need more protein, can we start listening to nature or God and think, what did nature or God expect us to eat? Now, the foods rich in fat need to be avoided, and that includes all animal products. I already explained that, as well as all refined plant fats. Refined means anything which is not from a whole food. That means we should eat foods that come only from plants, and we should eat whole foods as far as possible, unrefined foods. That's why we at SHARAN teach you how to cook without oil, how to make fabulous desserts without sugar, how to, instead of using any refined thing like maida or white rice, or even how to cook without peeling your vegetables. These are the things we teach you, and our food is just fantastic. So, like me here, in Oroville, there are so many restaurants that serve relatively healthy food, largely plant based, whole, even partially. But I don't feel like eating at those restaurants because once I know how to cook in this way, the food at home tastes so much better. And that's because of the quality of the ingredients. You don't always get high quality ingredients, organic ingredients in restaurants. Now here you see a chart which shows animal foods, and all animal foods contain a fair amount of fat, with mutton being one of the highest. And they all contain a fair amount of cholesterol, with eggs being one of the highest. Now, plant foods also contain fat. We need some amount of fat, but they never ever contain cholesterol because plants never produce cholesterol. And cow's milk, 49% of its calories come from fat. So just to see on this chart, it comes pretty high in fat. And buffalo milk is even more. And 2% milk, even 2% milk, 35% of its calories come from fat. And most of this is saturated fat. Saturated fat means the fat which is solid at room temperature, like all animal fats, but also some plant fats like, say, coconut. Coconut in this hot weather might be liquid at room temperature, but in the winter it's solid at room temperature. Now, there are also some medicines. Medicines always have side effects, and there are some medicines that can raise blood pressure. And I've listed all of them, but I'm just going to talk about the ones which are in bold. Alcohol. Alcohol is in so many medicines, and that can raise blood pressure. Then antidepressants sadly raise blood sugar and blood pressure. But we can get free of antidepressants. We can reverse depression through a whole plant-based lifestyle and few other things that we do with our consultations to reverse depression. So, the drugs that are used are highly addictive. And then caffeine. Caffeine is in coffee and energy drinks like Red Bull, but caffeine is also in cough syrups and other medicines. And then steroids raise blood pressure, and erythropoietin, okay, that cannot always be avoided, that's in kidney disease. And then estrogen, including birth control pills, and non-steroidal anti-inflammatory drugs like Dolo 650 or Tylenol. These can raise blood pressure. And so we have to be aware and cautious about all these medicines that we're taking. This is why we try to help people prevent and reverse diseases with lifestyle changes. Now, vitamin B12 should be supplemented as methylcobalamin, not cyanocobalamin, and a low dose, 500 micrograms frequently rather than 1000 micrograms every now and then. And the level should be around, the reports will say 211 to 911 is normal. But let's keep an average of 400 pg per ml, because that's what makes us feel good. And also, if it drops, it will not drop too low to cause symptoms, because symptoms are deadly, like hypertension and heart attacks. So, in summary, what should we do? We should change our diet. This is what we teach. Avoid tea, coffee, colas, and smoking and alcohol. Exercise. Rest at the right time. Supplement vitamin B12 and minimize stress. So, as we improve, we must reduce medication, because otherwise you can have low blood pressure, which is harmful. And I just want to say a little bit about what we can eat. What would be a regular diet? So usually when we wake up today, we have tea and coffee. And then breakfast could be cereal, porridge, eggs, toast, sandwich, whatever, idli, dosa, whatever. And then snack could be tea, coffee, cookies, nuts, whatever. Then lunch, sorry, I don't have the best menu plan here. Oh, I'm really sorry about this. So let's not look at this. I'm going to stop this share, and let me see if I do have a better plan right on this. No, I don't. Sorry. This was used for abroad, but let me show it and we'll just change it, and very sorry about this. But let me show it, we'll just exchange it and talk about it. So, lunch could be dal, chawal, roti, sabzi, and buttermilk or curds. Or it could be soup, salad, sandwich, pasta, pizza, wrap, whatever. So, and then lunch, the snacks in the evening are usually fried snacks, namkeens, and dinner could be again something like lunch, right? Now, what is going to be our new plan? Herbal tea and water with lime juice instead of tea and coffee. Now, if you just can't get rid of tea and coffee, then you could have, there's something called rooibos tea, Rooibos tea. It's a herbal tea that you can buy on Amazon, and you can make it just like your regular chai with chai masala and plant-based milk. And if you can't get rid of coffee, you could buy barley coffee. Now, SHARAN website also shows how to make these. Not exactly this, but you could make a tea without tea leaves and coffee without coffee, or you could buy barley coffee or chicory and make something that tastes like coffee but isn't coffee, and have it with plant-based milk or no milk. Then breakfast, no matter how you cut it, should be green smoothie and fruit. Now, a snack, if you really need it, could be muesli or porridge, or it could be idli, dosa, upma, poha, whatever, but with whole. That means red rice poha, millet upma, and red rice and whole with dal, idli and dosa. And then lunch would be whole rice or whole grain rotis, salad. At least 1/4 of the meal should be raw, no more than 1/4 should be grain, and the rest should be dal and sabzi, cooked without oil as per our guidelines. If you don't know about those, you can go to our website, go to events, and select the basic cooking class, and you can learn about it. And Reena will be also telling you how we have a few events that can teach these things. And then a snack. Here's what I suggest: fruit, green smoothie, muesli bar, or if you feel like having namkeens, can you have sprout chaat, chole chaat, aloo chaat, sweet potato chaat instead of those things. And then dinner could be salad. 1/4 of the meal should be salad. No more than 1/4 should be grain. And any main course that you like. So if you like to have, say, something different like idli dosa for dinner or khichdi, then make sure that you have the right amount of vegetables, the right amount of dal, not too much grain, and add a salad to it. Now, I do want to add the pioneers in this field. I talked to you about Dean Ornish and his book Reversing Heart Disease. Caldwell Esselstyn and Dean Ornish started their experiments at the same time in 1990. Caldwell Esselstyn followed up his patients for 12 years. Dean Ornish studied a larger group of patients for one entire year, and they found dramatic results. And Dean Ornish wrote this book, Caldwell Esselstyn wrote this book. I highly recommend this book because it's short and precise, and everyone can get free of heart disease thanks to one of these two books. Must read. Now imagine that these books have been around. This one has been around since 1995, and this one has been around since 2007. And yet there are people and doctors, cardiologists, who have not read these books and advise their patients only medicines when we can actually get well. Sharan has a cardiologist on our team. So how can Sharan help you? We have free talks, we have a lot of information and recipes on our website and YouTube channel and newsletters. We have cooking classes. Most importantly, we have consultations. And for those who feel they can't do it by themselves, retreats. I'm going soon to our 21-day retreat in June. We have one shared spot left, but our whole retreat is full, but we have retreats every year. So you have a year to try it out, and if you don't get the results, come to our retreat next year. Sharan is committed to building a culture of health, and we are doing this for the last 20 years through so many events and other things. And yet there are people who say, I don't have time for health. So here's a cartoon that says, what fits your busy schedule better? Exercising 1 hour a day or being dead 24 hours a day? And this is something to not really laugh at, because we are the authors, as Reina said, of our health and our disease. So I wish you perfect health, and I know that each one of you can get there if you're willing to make changes. If you have any questions, here's an email address, and I'm going to answer questions right now. Reina, should I answer questions?
Yeah, doctor, we have time.
Fabulous. So anybody would like to ask any questions? Did you understand what I said today? Please let me know if you understood. The recording will be shared with everyone who has registered here. And for those who are on Facebook, you can just go to Sharan website, and it will also be on our YouTube channel later, or you can register. Okay, did everyone understand what I said? Okay, I'm glad that most of you did.
Dr.
Would anybody like?
Kaushalya asking, what about diet for type 1 diabetes?
Okay, so that's a little out of the today's topic. Today I really want to concentrate on heart disease, hypertension, etc. But I do want to say that type 1 diabetes is an autoimmune disease, and there's a whole talk like this on autoimmune diseases on our YouTube channel. So don't miss that. Um, who asked that question? Whoever asked that question, please don't miss that.
Yeah, Dr. Arpita is asking, can we have 1 cup chai per week with fat-free milk?
Naturally, we can have it. But remember one thing, that chai is a bit like smoking. If you decide to stop smoking, but then you just have one cigarette once in a while, the chances are you will go back into that habit, right? It's like exercise. You know, someone wants to exercise and they say, from tomorrow I'm going to start, but that tomorrow never comes, right? So all these habits we need to do things to change the habit, not get onto it once in a while. Plus, if you have a cup of chai with fat free milk, it's not just the milk that is raising the blood pressure, but also the chai. So, do we want to temporarily raise our blood pressure? It's like adding fuel to a fire once in a while.
Dr. Shanti is saying, ma'am, I changed to whole food plant-based diet 10 months back. My LDL cholesterol has increased to 208 and triglycerides 216. What am I missing?
Oh, if your triglycerides are increasing, then you are missing a lot, and that means that maybe you haven't completely understood what a whole food plant based diet is, or you're not very cautious. So, here's what I suggest, please take a consultation with our nutritionist, and all of this can get better over time. Cholesterol may take some time, but triglycerides, if they are this high, that means you're eating something wrong. It could be sugar. If you eat extra sugar, it can convert into fat and raise triglycerides. When triglycerides are high, it means there is fat in your diet or there's sugar.
Dr. Darshana saying my B12 is 114. Doctor prescribed Nevrip OD.
Okay, nerve up is one thing, but you know, we have better solutions than that. So here's what I would suggest, methicobol or neurokind 500, not neurokind 1500. Methicobol or neurokind 500. Uh, shall I write it in the chat? Let me do that so that you have it with you. Okay, this should be taken every day, and these are the ones that I routinely prescribe for vitamin B12, but there are other fabulous solutions as well. There's also like a spray that you can use, or even like something that you just put on your tongue and it dissolves. So any good vitamin B12 which is methylcobol and not methylcobalamin and not cyanocobalamin can be used.
Dr. Muthuswamy is asking, any suggestions for low BP in the range of 100 by 70?
So low BP in the range of 100 by 70 is not harmful in any way unless you're getting symptoms. But if you are on a whole food plant based diet, the blood pressure will neither go too high or too low because the fiber controls both. So why does blood pressure go low if it causes symptoms is often because of medicines, and so we need to make sure that we get rid of these medicines.
Dr. Malik is saying, I'm making fried Kabuli chana with shikari as coffee.
Oh, you mean roasted Kabuli chana, right?
Yeah, probably that's what I mean.
Okay, roasted, yes, that's good. That's a good solution, and that's the kind of recipe that is on our website. And I would love to show that to you so that you're all aware of that. So let me do that right now, because so many people are into tea and coffee, isn't it? So, but it's not just the milk, it's the tea and coffee that cause these problems. And so I'm just going to share our website. Remember, we have 600 healthy recipes on our website. And sorry, if you go, no, this shows how to make plant based milks. But if you go to drinks and then you go to masala chai, the recipe for masala chai is here. And no coffee, coffee is also here. Sorry. No coffee, coffee is also here. Okay. Why is it in cold drinks? Because it can make a cold coffee, but it can also make a hot coffee. Whatever you like, you can do, right? So this is a cold coffee, but you can do similar for hot coffee. And the chai recipe is also on our website. So don't miss looking at our website to get ideas.
Dr. Parimala is asking for the new tea name.
New what?
Tea name that you mentioned.
Ah, yes, yes. Let me write
Right.
it in the chat box. You know what? I'm going to show it to you so you can actually find it. Um, Let me do that by sharing my screen. One sec. And I'm just going to type into Google Rooibos. Okay? And here it comes. So we want to not get rooibos tea, but what do we want? Better than rooibos? Organic rooibos. Okay? So we just look for that, not benefits, sorry. Uh, sorry. Okay, so we are going to look for organic rooibos tea, and it looks a little bit like this. Remember that there's so many, you don't have to buy this expensive one. This is like a huge amount. Hopefully, you'll never need that much, but you can find it at decent prices also. And uh, barley coffee. Okay. So this is something that makes you feel like you're having coffee, but it's not real coffee. And of course, you can make your own as per our website.
Dr. Akhila is asking, brain uses 20% of the carbs we consume in our meals. Carbs are essential for brain function. You suggested to consume 1/4 of grain portion. That's carbs. Doesn't it affect the brain function?
No. So wait a minute. Root vegetables are carbs, fruits are carbs, grains are carbs. I mean, if you're eating vegetables like potatoes or pumpkin or whatever, there's carbs. So we are not going to ever have a shortage of carbs, right? When you're on a whole plant-based diet, people don't ask about carbs because we're getting enough carbs everywhere. People ask about protein usually. And I want to assure you that we will get enough protein also on a whole food plant based diet, because nature and God will never be wrong, and horses and elephants get their protein from plants as well. Every single cell contains protein, so you won't have a deficiency of protein, I assure you.
Dr. Ranjan is asking, doctor prescribed me cyanocobalamin, 100 mcg tablets for B12.
I know, that's why I'm writing different. Just to make sure that you don't get into messes that are prescribed by others.
Dr. Darshana is asking, vitamin D is 8.2, medicine Uprise D360K weekly once.
No, wait. Vitamin, what?
Vitamin D is 8.2.
Huh?
Medicine is Uprise D360K weekly
No,
once.
see, vitamin D can be measured in different units. So is it PG per ml, or what is it? So here's what I want to show you, that you need to just go to figure out how much to take and what to take of vitamin B12 and vitamin D, I'm just going to share our website again. And if you go to the FAQ section, then you just need to click on vitamin B12 and then all these questions will be answered. Okay? So either you do that or take a consultation with a nutritionist, because
Doc-
everyone's levels will be different here. I can't answer each one.
Dr. Malik is asking, can we use Niger seeds as tea?
I don't see why not if that works for you.
Louisa is asking, does acupressure help in high blood pressure?
Acupressure or homeopathy or Ayurveda or Chinese medicine or allopathy, all of them will reduce symptoms temporarily. But you can't get rid of high blood pressure without removing the cause. That means you can't keep having oil and line your arteries thicker and thicker and take some acupuncture and expect to get well.
Dr. Kaushalya is asking, is tofu good?
For high blood pressure, not particularly, and not particularly bad either. But tofu is not a whole food because it's made from soy milk, and soy milk is not a whole food, the fiber is removed. So we should not have any of these foods in large quantities. I'm not saying that tofu is bad, but we have to be aware that it's not a completely whole food, and right now we need more fiber.
Dr. Rakesh is asking, what about nuts and seeds for people who have stents and LILPA?
Right. Um, Nuts and seeds, anyway, Sharan recommends only 10 nuts per day. And even seeds, if you notice, like sunflower seeds or uh, pumpkin seeds, these are very hard to open. So, if we were living in nature, we can't consume large amounts of it. So, we have to be careful. But sesame is easy to consume large amounts, or flax seeds are easy to consume large amounts. So, these are the ones that we can have. Flax seeds actually have a lot of fiber and they're good for high blood pressure.
Um, Doctor, last one, Darshana said vitamin D is 8.2 ng per ml.
Correct.
So
But
medicine given was Uprise D3 60K weekly once.
correct. So, then 8.2.
8.2, yes, ng per ml.
Very, 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 very low. So it needs to be between 30 to 50 ng per ml.
She's getting, okay.
Correct,
All right.
correct.
So the vitamin D, it's Uprise D3 60K weekly once is fine.
Yeah, yeah.
Yeah. All right. Okay. I think we are done with the questions, Doctor. Can I just share my screen about and letting everyone know what's
Please,
coming up?
please,
Yeah.
yes.
All right. Great. Thank you. So, So our upcoming events, we have two healthy potluck parties, one in Hyderabad and one in Mumbai next week. So do check out our website for details on that. Potluck parties are good fun to come and meet other people who are trying this diet or following this diet. You can even taste the food. So do check out our website. So if you're in Hyderabad and Mumbai or know someone in Hyderabad and Mumbai, do let them know about this. We have a beautiful unwind into stillness, pranayam and meditation program on Sunday, 24th May. So, Sharan works on all aspects of health, including mental health, because that makes a big difference on our physical health. So, hence, we have such sessions as well. We have the salad revolution coming back, which is one of our most signature programs where we teach you the importance of having salads, how to make them, different recipes. And now, with Modi ji urging us to have use less cooking oils and use less cooking. I think it'll be worth also with summers. It's the best way to have, and also great way to increase our fiber intake. So do join us at the Salad Revolution. And Dr. Nandita herself is going to start the session mentioning why should we be having salads. Then we have a beautiful cancer support group with cancer thriver Jayashree Kannan, who reversed her cancer, actually got cancer, then got a relapsed, and then decided to take charge of her health. And now she's cancer free since many, many years and helps and supports others too. So this is every Wednesday. And we have healthy book readings where we read Sister Shivani's books. We have Being Loved, The Power of One Thought, and Happiness Unlimited, different timings. Check out our website for details. Again, this comes into our mental health category. Sharon has an amazing website. Doctor's already shown you that. We are present on Facebook, Instagram. Please follow us. We also send out WhatsApp updates, free recipes, lots of information and details about our upcoming program. We have a YouTube channel full of very, very informative videos. We do consultations online. We have free talks, which you're just attending, potlucks, quizzes, cooking classes, seminars, workshops, lots of different kinds of programs, health retreats, and we also have amazing books that can help you. And just want to end with it is health that is our real wealth and not pieces of gold. So let's invest in what truly matters. Okay. Thank you so much. And
Thank you, Reina, for being such a wonderful host. And thank you, all of you, for being there and wishing you health always. And if you anything comes in the way, don't wait. Contact us and we'll help you.
Doctor, just one last request Malik has. Can you please release reversing diabetes in Telugu?
Telugu. I don't even know how to speak Telugu, but we will see. Nowadays Google has no, but they don't have translations like that. I don't know how. I don't know the solution for that. But if anyone wants to, yeah. So Malik, if you want to publish it and translate it, then we can get permission for that because it's with Penguin. But we can get permission for any other language besides Hindi because it's already there in Hindi and Gujarati.
So I'm sharing doctor's email ID to you, Malik. You can get in touch with her directly here.
Thank you for that.
All right. Thank you everyone for joining us today and wishing you and your loved ones great health always from all of us at Sharon. Bye bye. Thank you.
Bye, everyone.